Okay. So what are the symptoms of COVID-19 and who has a higher risk of serious illness? So some people become infected but do not develop any symptoms and do not feel unwell. However, they may still infect other people. So if you look at, there's a number of people that have been that attempt to be asymptomatic. So they'll have the virus, but they don't experience any of the symptoms. But as they interact with others, they've got the potential or propensity to be transferring the virus to other people. And that's one of the biggest challenges with this virus, the fact that you can't tell or it's not written on someone's forehead whether they have the virus makes it really, really challenging. And this is where the need to be careful becomes further important. So what are the symptoms and who are higher risk of serious illness? So according to current information, around 1 in 6 cases of COVID results in serious illness and the development of breathing difficulties, which can lead to death. So that's quite a number. So certain people are obviously higher risk of serious of illness if they're infected by COVID. So this includes those that are over the age of 50 years, people with weakened immune systems, so say underlying conditions such as diabetes, heart-lung disease. And generally, if you're feeling unwell and you're unlucky enough to contact or to contract the virus at that point, it's amazing for you. So why is COVID-19 OSH important for your business? So the law. So as employers, we do have a legal obligation to ensure the safety of our workers. And there's obvious penalties that come along with that. Now, I'm sure most of us know DJ Fanton and Levels, who threw a New Year's Eve party in Bari. Now, their line of business is entertainment, with Simu Damafins. But the end result is the law did not permit because there was law. And also the result, it was a 12-month sentence with 6 months suspended for good behavior. Serving 6 months, and the impact on their business is that they are not available to do more recording for music industry. So that is just there to put things into context in terms of how far your business can be impacted. The key question for yourself is, do you have plan? You know, what happens if one of your staff contracts the virus and gets sick? So take it further, what happens if staff think your workplace is unsafe? So the obvious is the morale at the workplace would drop. Productivity is also likely to drop. You are likely to pick a number of absentees or even resignations, and in some cases, industrial action. So that can have a big impact on your enterprise. So here's an example of a German factory where there was an outbreak. There was 101 staff that tested positive for the virus. So you imagine the impact of that operation. Coming closer to home, I think last week, Proton Bakeries had 5 infections in Marondera. That is obviously going to have an impact on the operation. And with the possibility of being shut down, whether a decision of my management or as a government or a minister of health coming in to take control of the situation. So what would be the impact of a COVID-19 outbreak at your factory? You know, how are your staff going to be affected? How operations be affected and for how long? What would be the financial cost? And what would happen when you try to reopen? So those are things that as an enterprise you consider, whether you're a gas business, a fuel station, a bakery, a retail store. Obviously, at the moment, you've got lockdown, so the focus will be on essential services. But when you reopen, you know, this virus doesn't look like it's going anywhere very fast. So those are things, those considerations that you made. And if the lockdown is relaxed, obviously enterprises are going to be reopening. So there's a need to have a plan. Okay, so control measures for COVID-19. Some of these are fairly obvious. I think by now a number of us come to understand and know them. Physical distance is an obvious one. So taking another option, wherever possible, staff should telework. Now, obviously not for every business, but particularly for high-risk areas of your jobs, like you identify through a risk assessment. If teleworking is not feasible, perhaps consider sustaining work until it is safe. The obvious one is to rearrange place to ensure physical distancing for all. Okay. So I just need to connect my battery. So where possible, ensure staff are 2 meters apart. And as much as possible, position staff side by side rather than face to face. If we're all facing the same direction, the chances of someone sneezing and it coming onto me become lower. So this applies to all areas of the workplace. So if we look at the slide, if you reorganize your workstation, people put 2 meters apart. This is in a sewing room. So it's much easier to do it in the context. But the situations where that is not possible, let's consider in a supermarket where someone selling at a deal has to interact with customers. It may not be an option to be 2 meters apart. Okay, so I'll just have a quick water break. Please bear with me. Okay, just continuing on. So the control measures for COVID-19 from an occupational safety and health perspective. So physical distance, we touched on. Where possible, staff are 2 meters apart. Now, it's not feasible for everyone to do this. So obviously, the control measures that we implement will vary from place to place. We can't take away from the reality that enterprises need to continue operating for income, provision of essential services. So we have to adapt controls that suit our environment. But where possible and as much as possible, let's implement the controls. So this is an example of a sewing room, gone as far as measuring the distance between employees. In this case, it's a possibility for them. So physical distancing at work, in this instance, they've put in guards, splash guards, some made out of perspex or wood. So each on their own. Now, obviously, in this instance, 2 meters cannot be feasible in the canteen. So you adapt controls to suit your circumstances. So workplaces, where possible, make them one way. But where it's not possible, perhaps consider taking turns. If someone's at the top and the other on the bottom, give each other away, let one go up, let the other come down. They just admit a few more people. Now, an obvious thing is disinfecting those handrails. Some instances where that stairway is the only access to particular areas of a workplace. So another adoption is continuous disinfection or scheduled disinfection. If you have alternative access, make the stairway one way. So the most ideal mentioned is making a stay, but it may not be practical in all situations. So this one, we've also seen it adapted in a number of workplaces. So use markings on floors, particularly when handling customers. Let them queue, give them spaces minimum 1 meter apart, the entry and exits. So elevators are a big challenge for buildings that use them frequently. So elevators, toilets, and other waiting points. So again, we can mark on the floor and ensure people are apart. And in the instance of elevators, where it can be avoided, use the stairs or limit the number of people. If it carries 8 to 10 people, 8 people, if there is no option. So another common thing is the installation of plexiglass barriers at all points of regular interaction. So, consider a supermarket or a retail station, the cashier, if standing behind the plexiglass, that becomes a splash guard. So they are protected. So where possible, avoid face meetings. I think with the advent of COVID, we've seen it, applications like Zoom, WhatsApp calling, they all made it so much easier to interact. And in a way, it actually saves on money because in the past, we'd all travel to visit a client or a supplier. Whereas now we encourage being online and the use of webinars. So in the instance of companies, consider doing your training online. If your employees can work from home or at particular stations, do the training online. Let them log in. You can make interactive videos or schedule training where there's multiple employees out in the field and everyone gets to log on. I mean, your additional cost is data, which can be offset with travel to and from training rooms. So in meetings, minimize the number of people. Is someone attending a meeting essential to be there? If possible, ensure participants 2 meters apart. Ensure the room is well ventilated. Open the windows. Do the use of barriers, the splash guards we discussed. If we look in the picture, there's 3 people at a table and the splash guard separating them. So as much as possible, avoid direct contact, shaking of hands, hugging, touching. Now, our culture, we're used to giving each other a handshake. But now I have to adapt and change. We touched on elevator before, 3 people or less. Display maximum number of people on the lift door, and first using the elevator should avoid facing each other. So organize shifts, particularly those in manufacturing. Staff should be assigned to specific shifts, and the same workers should be assigned to these shifts each day, cohorting. And for each shift, create smaller groups and assign these groups different times for entry and exit to the factory, taking lunch breaks or using the canteen. Again, it may not be feasible for everyone. It's about adapting the various controls to suit your circumstances. So movement between areas, it's common to have factories that have got units or production units, and common to have employees transferring from one area to another. Again, where possible, let's minimize that. Let's only do the essential trips, whether it be moving raw materials from one area to a downstream process. Those that have accommodation for employees, I mean, we've seen others are adopting to have employees come and stay at the place for various reasons. One, ensuring that production continues. Also challenges with transport getting to a workplace. So in the instance that you've created a dormitory or hostel, okay. This would depend with the situation, but may include rearranging beds, making walkways one way, uh, markings to markings to ensure distancing is observed while people wait, and the installation of barriers to separate those are accommodated. So delivery workers, so it is common to have deliveries to your workplace or you supplying other customers and doing deliveries. Again, when delivery workers arrive, they need to understand the processes and controls at your workplace. They should not come within 2 meters of other people. Where possible, they should stay in their vehicle loading or unloading. And the common we've seen with delivery, the use of paperwork. There are some factories where when you visit, you go to make your payment or from the start entering the factory, you interact with security, then you go to reception, then you move to sales, they print an invoice, you go and make a payment, and it is written and attached to the invoice. You take the invoice, go to the warehouse, hand it to the supervisor or the stockman, who then also processes it, asks you to sign. They hand it over to the workers to get the goods. Then they sign for it. The goods are brought to the vehicle, they're loaded. Then the security guy comes to check that the goods loaded are the ones. And across this whole process, paperwork being transferred from person to person. Along the way, we share pins. So those are all transfer opportunities for the virus. So where possible, let's look at reviewing that paperwork to minimize the transfer or to minimize the risk of spread. So transportation, especially in lockdown times, that during normal business times, transport is a challenge. So for those that are arranging transport for their workers, where possible, organize extra vehicles to maintain physical distance. This may not be feasible, but let's disinfect the vehicles. Let's ensure everyone in the vehicle wearing a mask. And the other thing is, it's one thing to implement controls at work, but we also need to look at our employees. When they leave the workplace, let's train them and conscientize them with the risks of COVID. That it's not only about being at work. It's about on your way home. It's about what happens when you get home. We'll touch on that a bit later as well. So again, as they queue up to get on the bus, let's physical distance. Let's keep seats between persons. So outside of work, let's encourage our staff to follow the same rules that we apply at work, because the disease is not just at the workplace. Let's request them to follow through, whether it's the physical distance, the washing of hands, the use of sanitizers, a scenario in the home. You've gone to work, the children have stayed at home, you go and play next door. So imagine a visitor that has come from overseas or from wherever, and they have the virus. So there is that chance. So those rules, only should we implement them at work, but let's encourage us to have those controls in their home. I mean, the purpose of the lockdown is that we stay indoors. And if you're essential services worker, then you can't get away from going to work. But for those that stay at home, let's also put those control measures. Wash your hands regularly. Let's limit visitors. I mean, our culture, we used to now WhatsApp. And recently, the government put a rule that you will only be buried in the town in which you die. No when and it's part of curtailing those this disease. So in our homes, let's look closely. What interactions do we go? What time do we go to the supermarket? If you go lunch hour or around 12, chances are there'll be a lot more people. As you'll probably be a few customers within the supermarket. and physical distancing doesn't become a challenge. So business travel. Can avoid business travel. Outside the workplace should be avoided unless it is absolutely essential. Let us assess the infection risk. Where could staff touch contaminated surfaces? Should staff be within 2 meters of other people? And let's plan measures to minimize these risks. For workers at high risk of serious illness. So certain people are at high risk of serious illness if they're infected with COVID. So we touch people over 50 years of age, the weakened immune system, conditions such as diabetes, heart disease, and lung disease, and other underlying conditions. So these people do not come to the workplace where possible. While a risk of infection remains, in fact, they should not come because once there's an infection, if they can't get it, then our statistics are going up. So pregnant women also should consider to come to the workplace while a risk of COVID infection remains. So social security here, I know NASA is come up with a scheme around managing COVID, it being a workplace illness. I don't have the specific details, but sure if you go into the NASA website or some of these ministry announcements taking place, there would be more information. So I urge you to look into those and to see what's applicable. So let's ensure workers do not come to the workplace if they have any of the following conditions. So COVID-19 symptoms. And this one can be a particular challenge, particularly casual workers where they know if they don't come to work, they don't get paid. Or sometimes someone doesn't want to use their leave days or sick leave. They are coughing, sneezing, or have a headache. Encourage them to communicate to their supervisor. This is the situation I'm in, or I'm just saying symptoms. And then a decision must be made from that point. And that discussion is very, very critical. So anyone who's come into contact with COVID-19 positive patients in the last 14 days, which is considered the incubation period virus, living in the same house as a person in quarantine, those are high risk situations that we need to look. And if we count 14 days, I think that dates back to around the 27th or 28th of December. If you came into contact, you're still at risk. New Year's Eve, 14 days, no So hygiene is an important control, one of the most critical controls around managing the virus. So let's ensure our staff avoid touching their eyes, nose, or mouth. Some people react to pollen or sprays. Let's teach our workers, conscientize them to avoid scenarios, consequences, because this is how you get infected. So hand washing, ensure you have wash stations, that the employees are washing their hands regularly. This also applies at home or in general, where you can use sanitizer is great. Now the sanitizer will kill the virus on your hands, but it doesn't make your hand clean in terms of dirt. Just general hand washing, ideally with soap, minimum 20 seconds, helps curtail the virus. In some workplaces, let's install some wash stations, the buckets kept on a stand. In an ideal situation, I've seen the operated ones to avoid touching the tap. So let's look at those circumstances in our workplaces and implement them where required. Touched on that. So key places, entering and leaving a workplace, before and after contact with co-workers or customers, after going to the bathroom, after secretions, excretions, and body fluids. So let's practice that hygiene. Now, a common area is when you enter many factories, there's a security guard with security with the gate. You come and you handle the gate, open it. The security guard asks for your ID. Is there really a need for the cigarette to hold your ID? Or you can read out the ID number, or they can look with their eyes. In some instances, we've seen sanitizers at the entrance, but the rest of the building, no sign of sanitizer or wash station. So after contact with potentially contaminated enclosed machinery, vehicles, and confined space for delivery before and after loading or unloading vehicles. So best practice of hand washing. In minimum 20 seconds, let's use soap, wash the back of your hand, inside your palm, between fingers, under nails. I mean, this diagram is readily available online. Let's download and let's share with us. So installation of hand washing stations, we've touched on that. This includes entrance and exit areas, toilets, canteens, um, travel from work or the bus. Okay, so ideally, let's provide tissue papers to dry our hands. Let's have soap, water, and hand sanitizer. And the sanitizer must be a minimum of 6% for them to have that efficacy. Uh, let, let it all be accessible to all staff, contractors, clients, or customers and visitors. And we must regularly restock. Now, it's one thing having soap station. If you don't top up the soap, you're actually not achieving the objective. So respiratory hygiene. Cover your mouth and nose with a bent elbow tissue when coughing or sneezing. Now, things that make you sneeze are sneezing can happen as a result of pollen or other issues, chemicals in the area. So when it happens, move your elbow into position, your mouth, and cough into the elbow. And we limit the spread that way. I think you can see that from the picture. So tissues, if you use to immediately discard them in a bin. Let's not leave them lying around on surfaces and end up with someone else having to come and clean after you. So let's avoid practices that involve multiple touching the same objects. So avoid to sign attendance sheet or provide fingerprint scan. We're all taking things to touch the same piece of paper. I think I gave that scenario of purchasing materials at some retail stores. Assign supervisors to check their attendance. They count their staff, they know their employees. Perhaps they can enter it on a computer or write one paper and sign for everyone. So avoid providing shared water glasses or plates. In the event that there is limited numbers of those, let's make sure that they are washed thoroughly. So encourage staff to bring lunch boxes and water bottles from home. Let's avoid the use of cash by staff. And cash is a big thing for us, particularly US dollar. To know that my US dollar, but carry the virus. Now I've seen some service stations, they collect cash, but they also spray it. I think with sanitizer or disinfectant. Whether that's good or bad for the note is another thing, but at least they're taking precautions. So, in this time where possible, digital payments are the key to avoid the hand of cash. Cleaning and disinfection. So the difference between cleaning and disinfection. So cleaning uses soap or a neutral detergent, water, and mechanical action. I think we touched on the washing of hands. You remove debris and other materials from surfaces. Now, disinfection on the other hand involves the application of chemicals to inactivate pathogens and other microorganisms. So that's the key difference. So this is in workplaces you encourage to disinfect, and the disinfection is actually easy. Buy some sodium hypochlorite solutions, not necessarily G or other brands. Top it up with water, use a cloth to wipe down. There's different methods to apply disinfection, but this must be regulated and it must be scheduled. So we did touch on this earlier on. Identify your high touch areas, the door handles, in and out of building. You know, the entrance is where everyone working there comes through that entrance, and everyone has to touch the handle. Is an option to put a brick to stop the door from closing and people walk in and walk out. I mean, one of the good things about Zimbabwe is the beautiful weather. It's not always necessary that the door closed. So carry out regular cleaning and disinfection of these high touch areas, and these are likely to include your doors, door and window handles, table surfaces, work surfaces, laptops, light switches, bathroom surfaces, the flushes in the bathroom, toilet taps, kitchen, food preparation areas. These are all high touch areas. So you're also encouraged to clean regularly. I mean, nowadays we're on our phone most of the day. If you've touched the surface with the virus, then you come and touch the mobile phone. There's a great possibility there's a virus on it. Using alcohol, clean your phone, back, side, and let's make sure that we kill that virus. So we touched on providing transport to work, regular disinfection of seats, seatbelts, the windows, window handles, the doors in and out, particularly our combis. And the combi is one of those areas where, we see a lot of people get at the back of trucks. When you get in the back, encourage us to ensure that they put on their mask. Social distancing can be difficult in the tray of a pickup truck, but you can put on your mask. And sometimes, then we're back to distance. So how often do you need to clean and disinfect? So it depends on how the area is used. But minimum, let's make it once a day, if possible, twice a day, in the morning and in the afternoon. For high touch areas or surfaces, it may have to be several times per day. And again, you can see in the picture, pair of gloves, your spray bottle, which probably has got a sodium hypochlorite or other solution, and cloth, and you wipe down the surface. As warmer. So it's important to do the plan, do, check, and act. Let's allocate responsibilities for all cleaning and disinfecting tasks. You may need to hire extra staff tasks. Also encourage all staff their own workstations regularly. Are suitable. So tables in the dining, soap and water or sanitizer containing 70% isopropyl alcohol, ethanol based. For floors, you need 0.5% sodium hypochlorite solution or 1% chlorine solution. So light areas inside vehicles, 0.1 sodium hypochlorite or 70% ethyl spray. Now, any suitable or standard product will have instructions on how to do the dilution. You can buy the product, prepare the solutions following the instructions and apply. So others, open your windows to ensure adequate natural ventilation in the place. So if you can improve the exhaust ventilation and provide clean makeup air to rooms and operations with high risk exposure to the virus. So provide adequate rubbish bins in all areas and collect and dispose the rubbish regularly. Now the one disposing also needs to take appropriate measures to minimize the risk of the virus. So cleaning and disinfection exercise, these are questions for yourself. So identify the high touch areas in your workplace, create a cleaning plan or schedule, specify where to clean, when to clean, and who's going to do the cleaning, place particular emphasis on high touch areas, create a system of recording so where has been cleaned, when the cleaning was carried out and carried out. Very important. So PPE, develop a policy of wearing face mask. Now wearing the face mask correctly is very important. Often you see them hanging under the chin. The correct way of putting on your face mask to ensure that it's covering up and your nose. And a simple test, go in and out whilst putting your face mask. If it travels towards your eyes, done fit testing. Try and minimize that. If you've got break type of masks, the ones with the wire inside, shape it to suit your nose. Um, Currently, by law, it's a requirement to face mask. Where required, put on gloves depending on your in your workplace. So this slide is on do's and don'ts. So ensure safe and proper use before handling the safety. Clean your hands. Inspect the face mask for any damage. I've seen people wash the face mask and then put it on. You've just made it wet and possibly made it a suitable environment for the virus. So they have to put on the face mask around your ears, not on one ear, and importantly, it covers your mouth and your nose. So they do carry some risk. The masks themselves, they could be damaged, they could be very loose, and that's a common problem where the mask is too big. And you can see that, yes, in a way, it's covering the nose at an angle, but not fully covering. So do not remove the mask where there are people within a meter of you. Do not use a mask that is difficult to clean. Utagomanya or misting could collapse. And do not use a wet mask and do not shame. So as employers, we would ensure that PPE is provided in sufficient quantity and quality. PPE is available in all areas, so this includes vehicles. Disposable PPE must be disposed of properly, and non-disposable PPE must be inspected and cleaned frequently. Should not be hid by different people. So safe disposable of waste. So things like tissue paper, disposable PPE, your hairnet, your boot cover. Let's take appropriate actions for handling. Incinerate or burn them where they can be incinerated, and clearly mark items that need to be recycled. And if possible, you can have a system of sealed containers. So training and communication. So it's one thing with this anakubasa, but let's ensure that our implement these activities or these controls at home, on the way to work, and in the workplace. So, let's educate each other on the COVID-19 transmission routes and symptoms, practices to follow, and when to respond if a staff member is infected with COVID. Now, a question for yourselves is, what is our plan if someone starts to display the symptoms in the workplace? Do we have an isolation room? What support structures do we have? Do we have external doctors, if possible, or experts that can assist? I know many people talk of calling the main number, but let's understand that this is a countrywide, this is a worldwide problem. So chances are they are inundated. So your phone could go through. And if it goes through, they may not be able to respond. So what precautions can you take in your workplace? What happens if someone collapses? Maybe not because of COVID. If someone collapses, how are we going to respond? Some prizes are first aiders. Are those first aiders going to run action? Have they been trained on COVID? Do they have the appropriate PPE? What do you do individual that is collapsed? Those are all considerations that need to be taken into account. There is no one size fits all answer. It has to be customized to suit the circumstances of your enterprise. So, how to keep the immune system strong? Again, this is important for individuals. Eating nutritious food, limiting the alcohol intake. I think now when sale of alcohol has been banned, get efficient sleep. Now, tataru, ginger, garlic, zumbani, lemon, kunatira. Those are things that help with the symptoms, but let's understand that there is no cure for the virus at the moment, or the corona disease. So, but aungatange kumanya maya kuda kushandisa zumbani nekunatira nekuti wakurwara. You want to put these things into action before and get used to it. manje utanga utsvaka kuti mvura toboilisa kupi nekuti so let's educate each other. Let's look at implementing these things. Educate the people at home. Educate your relatives. Because it's one thing doing the controls at work. You get home, you do the extreme opposite. The people you live with are doing the extreme opposite. You're putting yourself at risk. So our employees have the right to remove themselves from a work situation that poses imminent danger for life or health. Now, ideally, let's work with our workers to encourage to raise the risks and come up with solutions. The person who understands the circumstances on the ground is the one who works in the area. Now, of course, the laws lay down procedures, give those powers, but let's inform the supervisors of the virus situation. Let's not threaten people with losing their jobs. Often people take risks because they want to protect their jobs, but in this circumstance, that's the worst decision one can make because they put themselves at risk or others in the workplace at risk. They obviously have their intent under social security if they fall sick. No, some companies have adopted sick leave policies the center around. So if your enterprise can do that, I encourage that you do so. So when preparing information to share, one of the obvious challenges we have in this day and age is the of social media. It's a great tool to have. We see a lot of things on it and a lot of funny things. But equally, the information that is passed on, some of it can be incorrect. So let's four of the sources of information that we adopt. Let's create a system to ensure that this information is collected regularly and kept up to date. Minister of Health, I know they've got a publication they send out on a daily basis. Media houses are also doing the same. So also communicate to staff the importance of only using information from reliable sources, counteracting rumors and misinformation. We go back 8, 10 months ago. Time was chirwere chevanhu vane mari, chirwere chevanhu vanofamba, vamwe voti chirwere chevarombo. A lot of various things, chisi chekuafrica, all those sort of things. That misinformation, unfortunately, there are people that may not have the exposure to differentiate what's wrong and what is right. I mean, you don't know what you don't know, you know what you know. So counteracting rumors and misinformation becomes very critical. Sorry, guys, if you've got your microphone on, please kindly switch it off. Okay. Sorry, guys, just bear with me for a second. Okay. So just to respond on one comment I've seen here, the use of footnotes, the rationale. Well, I guess the rationale around it is that you wear your shoes come to different contacts. Perhaps you handle your shoes after when taking them on or off. Um, so the rationale is that the foot mat has got disinfectant on it. It will kill any virus that is on the sole of your shoes. Whether I agree or not, agree with it or not, I mean, it's a control measure and circumstances will vary. Um, okay, so methods of communicating. So posters, message boards, paper, electronic, but again, let's minimize touch the person them on from one person to the next. Video and audio files, I mean, this can be played on speakers or sent through platforms like Viber or WhatsApp. Communication methods, emails and social media, face-to-face training. But again, let's make sure we social distance for those with training rooms in the workplace. And we implement other controls that limit the spread of infection. So engage workers in providing feedback. I mean, commonly, particularly where we have chief practitioners, supervisors, managers, it's easy enough for us in the office to come up with solutions and controls for the floor. But ultimately, the people that are in the heat of the action are the ones on the victory. So it's important for us to engage our workers. Let's do tools with them. Let's do the risk assessments together, identify the high risk areas. Let's regularly engage with the workers' representatives or trade union reps if they're in your workplace, or a workplace coordinating team. For those safety committees or teams, those are the best platforms to look at the risk and implement controls. Training on communication, I think we touched on that. In the workplace, you can create groups for regular communication and updates to your workers. But equally so, the downside of it is rumors can spread misinformation. So yeah, just be careful when going down that route. So what are the required actions when an employee is currently and they meet one or more of these criteria? Right, they've come into contact with someone with COVID, or they display symptoms. So contact history with COVID-19 positive patients during the last 14 days, live in a house with the person currently quarantined. So clear plans should be created for the management of people with COVID-19. I mean, I did ask the question that if someone collapses, what's our response, or they start displaying the symptoms. And these plans depend on whether the employee is currently at work or at home. Obviously, the circumstances varying and the support that can be offered between work and home. Um, so the required action on an employee is at the workplace. They're suspecting COVID, they come into contact with someone the last 14 days, they live with the person currently under quarantine. I mean, the obvious control is that employee should be placed in an isolation room awaiting transfer to an appropriate health facility. Limit the number of people in contact with the employee. Employee and people in close proximity should use PPE times. Perform thorough cleaning and disinfection of the workplace. Arrange for health surveillance of persons who had close contact with this employee at work, at home, and at home. Now, health surveillance becomes critical because perhaps you already tested, you are positive with the virus, but you are asymptomatic, you're not displaying any symptoms. Right. So if we know earlier that you're positive, then mitigating controls in terms of provided to the person can be taken at an earlier stage. So required actions when it's carrying home. The employee who suspected symptoms of COVID should also contact a medical professional and follow all other health guidance from our authorities. So COVID-19 surveillance, so staff should self-monitor symptoms of COVID. They should inform their supervisors. People they live with develop suspected symptoms. If they notice other employees with suspected symptoms, now this one can be challenging where people feel that they are reporting the employee and jeopardizing their job. No, this is a life and death situation. So your colleague might not feel the difference. They think they are okay, or they're embarrassed or scared to raise that they've got symptoms. So you observe someone, the obvious thing is to raise the issue with your supervisor or someone of position that is close, and we manage that risk. No point keeping quiet, and then a lot more people infected, including yourself. So keep records of attendance of the workplace and any meetings that take place. It makes it easier for contact tracing. Okay. So thermal screening, I think most workplaces now have the temperature guns. That's in line with government requirements. Now we mentioned that 38 degrees and above, that's the common symptom. Now, of course, there's temperature guns. They need to be looked up. They need to be kept clean. They need to, there has to be basic training with the person using it, measuring the temperature. Just make sure that the batteries are fine. Vamwe by a battery near 36, so these draws, that we need to explain that the purpose of doing this exercise, what it is, and the importance of doing it properly. Now you can see in that picture, security guard is also wearing a face shield and a mask. Now those security guards are high contact persons because often everyone coming into the yard comes into contact with them or interacts with them. So let's look at those measures. There's a wash station that's there. A good idea to adopt one at the entrance as people come in. So non-touch thermometer or thermal scanner, I mean, fancy ones now that you stick your head in front without anyone else hold the temperature gun. Already knows you if you're good to go or not. So identify and manage risk of transmission caused by the thermal screeners. That's an exercise to do in your workplace. So it's not just about knowing these measures. It's about doing them all, doing them effectively, and most importantly, doing them all the time. It's one thing to do it because it can no good by the roadblock, remember purista, but do it, apply it at home. Apply it when you're walking with your friends. If you're traveling from work home on foot, maintain distance between each other as you walk. Avoid sharing of and utensils and other things. And it's about the discipline to effectively and consistently do it. So, examples of measures undertaken, I've mentioned quite a number. Wash station, masks, sanitizer, disinfectant, social distancing, where possible, walk to work if you can avoid getting on bus. So numerous, but again, adopt it to suit your circumstances. I'll just have a water break, so please bear with me for a few minutes. Okay, so just to continue on, so using OSH management systems to respond more effectively to COVID-19. So look, with OSH management systems, some enterprises and some are in the process of creating and some do not have. If you already have an OSH management system, it makes it a lot easier. It's more systematic and effective. If not, there's a module that we do offer and the support that we do offer. So you can always engage for assistance in that area. But it doesn't take away from the basic practices of handling the virus. So a good practice is to have a joint health and safety committee. So if you already have one, or if you don't have one, create one. And this should help in the COVID response. So when a committee, there should be equal representation of workers and managers of men. Ideally, equal representation of men and women. Now, obviously, that varies from enterprise to enterprise. There may be more or less of the genders, so you accommodate everyone. If there's a trade union at the workplace, it should be part of the committee. So we have an in-depth knowledge of their jobs and work areas. So they bring critical insights to risk assessment, feedback on effectiveness of COVID-19 control. So ensure all members develop adequate knowledge of COVID-19 symptoms, transmission and control measures. Create a system to ensure that the JHC regularly gathers information about COVID, the symptoms, the transmission, the control measures, and let's use reliable sources. Ministry of Health is the primary source, but there's also numerous other sources that provide very good information. World Health Organization, I think the UN agencies as well, which are quite active on social media. Newspapers regularly do publications. So someone in the committee should gather that information, let's share it with the workers. So committee numbers depends on the size organization. If it's a small number, 2 people can work on it, or 3 people. Important is we clearly assign roles in terms of what we're doing. What are the key advocates? Transport to signing in, registration, things like locker rooms, change rooms, canteens, work areas, the shop floors, the offices for those with shops. What happens in the shopping area, on the display rooms, or change rooms, toilets, break rooms, all those should be considered. And for production facilities, a good practice is to walk down the production line, at the beginning, right through to the final product end. And as you walk through, you identify the high risk areas and come up with the control measures too. So we did touch on assigning clear roles. It can involving roles for each process. So the risk assessment itself for COVID-19, and there's no harm carrying out a COVID-19 specific assessment. Control measures to manage the safety risks, the emergency response. We did touch on if someone collapses or there's symptoms, or is suspected to be infected, monitoring and evaluating the implementation of your response. And this is a critical step. Some have implemented very good controls, or what seem to be good controls on paper. But as they implement, they then don't do the follow-up of this control. So that take is critical to identify gaps, or maybe you've overdone it, so you need to go back. If you've underdone it, you need to do more. So community staff that management is committed to and taking responsibility of reducing the risk of exposure. And controls very effective. So communicating and sharing with them, encourage them to participate, to raise issues, becomes essential in managing the risk. So consultation with workers and the in order to guide this risk of COVID-19. Highest risk is usually on the shop floor because that's where there is more people. So they may not have the social distance or other measures. So risk assessment. So identify the hazards and assess risk of COVID-19 infection for staff. So being sure to include all the jobs that are undertaken, all areas of the workplace. In terms of jobs, all the jobs have to be undertaken on a regular basis. Can some be postponed? All areas of the workplace should be listed. All areas that staff travel for work, risk to staff, contractors, customers, and visitors. Contractors, they come in and out. Consider your electrical service person. They can visit multiple workplaces. So all those are exposed and can bring that virus to your workplace. So let's have controls around them. When they arrive, let's induct them to make sure they understand the controls that are in place. Let's isolate them. Do they have to be working with our guys or can be working on their own? So those contracts for contractors. Some useful questions for yourself. Surface contamination hazards. Which surfaces or objects or touch? Let's include people such as hands, clothing, masks. Which surfaces might people cough on or breathe on? Physical distancing hazards. In which areas may people be closer than 2 meters from each? It may be useful to repeat these questions for each job or category job and each area of the workplace. So identify the hazards. Right now, for those that haven't done any risk assessment, a basic table where you list the area, whether it be, for example, pump house, for argument's sake, or the till area, or the gas filling shed, depending on your circumstances. A basic table where one column captures the area, a second column captures the hazard. So for those that use swipe machines, you're going to over the swipe machine for someone to enter their PIN. Few people will be comfortable handing over their PIN. So there's an area, cashier, and the hazard is the dashboard of the swipe machine. So what do? So draw them on a map, produce a table for each area or job type. So assessment of risk levels. Now, key things to consider is the probability and the severity. What others tend to call severity is the consequence, and probability being the chance of something. So what's the probability of being exposed to COVID-19? Do you come closer? Do you interact with that? Through contact with contaminated surfaces and objects. So severity of resulting health outcomes, taking account individual vulnerability factors. So we're looking at age, we did for 50 years, pre-existing medical conditions, or better known as the underlying conditions, and measures available to treat people with COVID-19. So record the risk clear. So basic table, the area, the hazard, level of risk. So level of risk you can break into two. So that is the probability of the coming. So update the risk assessment regularly, especially for new work processes. The plan the COVID-19 risk control measures at minimum. All control measures in Section 3 should be planned and implemented. Additional control measures may be required, which is specific to workplace and respond to risks identified in your risk assessment. So for me, the obvious that are not even out. Face mask, washing of hands, and physical distancing. Now, 2 meters may not be feasible, but we don't have to be standing next to each other. Where possible, let's not be facing each other. Now, the instances, let's look at loading bags of grain or flour, where it's a 2-person lift for manual handling. What options we have there, or everyone's wearing a mask. Maybe we look at, what do they call them, those face shields that some participants can put on. So record your control measures in your COVID-19 prevention plan. So area we touched on. Of control, is it a physical distancing, mask? Is it washing of hands? Now on the control measures, when it's physical distancing, let's look at the layout of our workstations, and we're getting let's ensure our position 2 meters apart. Entry and exit areas, let's have masks markings on the floor to ensure physical distancing. And we set deadlines for implementation. Kunyora nekufunga kunetsa, but implementation ndo pane nyaya yese. So we set a deadline. We assign someone responsible for the action, and let's hold each other to account. Kana tati tukuita by Friday, tinge by Friday, and our actions, let's prioritize them. They're not easy to do. Putting one action is not that difficult, but where we're moving workstation may be a challenge that may require some time to do so. But again, find someone responsible and let's hold each other to account. So response plan for suspect cases, the best is to have a procedure and that procedure being shared so everyone knows and understands. Expand the tasks that need to be carried out, which staff will be responsible for carrying out these tasks. Not everyone has to respond. Let's have the right people respond, the right people, the right PPE, the right training, the right expertise. And let's provide clear instructions or training to the staff to ensure that they carry out their roles effectively. So the monitoring aspect, we spoke about plan, do, check, act. The checking is very, very important. So inspections to be before reopening. Right now, during lockdown, at some point, lockdown will be relaxed. So closures may appear throughout the pandemic, and as a result, government restriction or an outbreak of COVID-19 network victory. Before staff return to the workplace, following closure, expect implementation of control. Now, not everyone is closing because of COVID. Now we're closed because of lockdown. But when we come back to work, again, people are coming back from different circumstances in their homes. There are those circumstances that take place. So a good practice is to regularly keep in touch with the employees, understand their setting at home, understand what they're doing. And those, should someone come back immediately to work? And when they come back to work, we obviously have to do some retraining. We have to risk assess our workplace and let's implement some control measures in a day too. So conduct regular audits. So if you've got safety, that committee should regularly audit the implementation of control measures. Let's do checks on implementation, it being on time. There's some just do it action, hand washing station, $10 chaiyo, budget native ongodira siku, $1 chaiyo. So checks on ongoing compliance, other workers washing their hands at the required time. How often do they do it? If they go out to the bathroom and do they dispose of their gloves? Take new ones when they come back, or when they come touch the outside and on their gloves. All those things need to be considered. Is everyone wearing a face mask? And you'll be surprised how often, how many people actually comply with wearing a face mask. Not even bans of road. People suspend their face mask, but ne would buy tampuri sanga masoja waguchi manya. And the work is fine, just like we do with all the other disciplinary issues. And let's shy away from holding people to account. If someone has to face disciplinary action, this is a life and death situation. So if you can, people have been fired for less. So let's not shy away from taking a hard stance, particularly in the situation. So audits will be carried out for each area. Again, we spoke about transportation to and from work, delivery of goods, signing attendance or region, the change rooms, lock rooms, use of cafeteria. Are we taking tents? Toilets, sharing. Let's do those audits. Are all these areas being cleaned and frequent? Are they being done frequently? So audit frequency, it should be high at first, can be reduced. It's better to do more and then scale back if performance is improving. develop a corrective action plan for each after each audit and quickly implement corrective actions to improve audit compliance. Uh, it's common for us to suffer decision paralysis control. So based on your COVID controls and your prevention plan, produce a checklist for regular auditing. Basic checklist. Is there enough PPE? Is the transport, the bus is regularly disinfected? Is the workplace regularly disinfected? Checklist based on controls or the prevention plan you have, put it together and do the checking. And from it, any issues that arise, we do more, implement more controls or measures. Key questions for evaluation. Was the COVID-19 risk assessment carried out effectively? Were all necessary control measures identified and planned effectively? Were all planned control measures implemented in a timely and effective manner? Was the monitoring carried out effectively? Right. So my controls, again, easy enough to do things on paper. The way it's important is the actual implementation and checking if it's effective. And it's not, we adjust. So prevention and response plans, both monitoring and evaluation, gather adequate feedback from workers and representatives in their work area and how effectively the measures are being implemented in Bali. Where we implement control that are inappropriate, that do not work. Let's review each and make sure that in the resolution. So of course, these regular updates, revised information from public health authorities. Let's make sure they are reliable sources, updated risk assessments, findings for monitoring and evaluation of the initial plan. So OSH responsibilities. So just bear with me for a couple of minutes. Okay. All right. So back to it. So OSH responsibilities. As employers, we must collaborate with the health authorities on the prevention of control of COVID-19. Now, collaboration is broad. Social media to interact and our phone for support. So implementing control measures. Employers in consultation with workers and their representatives should implement the risk control measures that we've touched on, any additional measures that we identify as necessary through that risk assessment. So as employers, again, provision of equipment, the PPE, Is it enough? Is it of the right quality? Provision to workers to ensure they can implement measures effectively, and monitoring the implementation of the control measures. COVID-19 risk control measures in the workplace must not involve expenditure by workers. Like everything else, kubasa kubasa. We should take responsibility because people are coming to work. Uh, Compliance is a big thing. I mean, social security in our country is NASA, and there's requirements for that, which I hope you're all familiar with. If you visit their website, it is there. I understand that COVID is now being considered as a workplace sickness. So let's look at that. NASA gives comprehensive insurance for employees, but they obviously have to be registered and the remittance up to date. So employers must keep an up-to-date list of workers who are on their social security, and in line with national standards, employers should expand to access to paid sick leave, sickness benefits, and parental care leave and home all workers. So it's about looking after each other. These are unusual circumstances. Obviously, COVID is a new thing, and we're all learning as we go, but let's all take care of each other as much as possible. So employers, let's inform workers of our rights. They all have a right to remove from themselves from a work situation that poses imminent and serious danger for life or health, just like any other safety and health circumstances. If it's high risk, we say stop work and raise the issue. Once workers have reported these situations to their supervisors, the employer should not require workers to return to work while there's continuing imminent and serious danger. Purpose of this assessment is to find the apparent issue. And they just said, no one is sana, so our risk assessment. Is the risk as bad as it is said? Sometimes it's about being informed. And then what controls can we implement to mitigate that risk? And when we implement those controls, we've mitigated the risk, but is it low enough risk for us to continue with work, or we need to do additional? So as workers, we also have a responsibility. We must collaborate with our employers. We take care of ourselves and of others around us. So workers must take reasonable care of their safety, not other people who may be affected by their acts at work. So participating in training provided by the employer. Let's make sure that that training is exciting to people, attentive and engaged. Complying with control measures specified by the employer. Again, the controls we're implementing is to look after everyone. It's not for one particular set of people. Using safety devices, protective equipment correctly and not rendering inoperable or unsafe. Wapiwa face mask, ngaipfekwe zvakanaka. Wapiwa wash station, ngatigeze maoko. So reporting hazards. Workers must report immediately to their supervisor any belief could present a COVID hazard and which can themselves correct. So like anything else, report to the supervisor. But in this instance, we're talking of a life and death circumstance. So it's important to communicate earlier rather than later. Communication in the workplace around all matters can be challenged. So training, I think we've touched a fair bit on training and the actions that follow. Shit. Sorry, guys, I just realized that I was on mute all along. But anyway, I think it's just responsibilities for the workers. Let's make sure that we educate and we train them. Let's make sure that they take reasonable care of their own safety and others. So, Chuck, can you tell Stan I'm in a meeting? Stan. So participating in training providing in the time. Sorry, guys. So participating in training provided by the employer, complying with controls that have been put in place, using safety devices and protective equipment correctly, and not rendering them inoperable and safe. So we all have responsibility as workers and management. It's about working together, collaborating, and to ensure that we're all safe. So reporting hazards, workers must be encouraged to report hazards. Let's raise issues, but it's not good. Apo pari unsafe munobo amira. Ndaona apo pane hazard. Muendesana na supervisor pamwe kwakuonesana kuti okay, that hazard, how do we manage it? Twitter say basa riite riende mberi. Without a doubt, what workers and management together is the same. Without something, and the other person is literally earn a living out of it. So we all have interest, and it becomes important that we work together. So training and consulting action. So, we touched on the committee. Obviously, the committee must be well informed. They're the best to drive the assessment and the implementation of controls, but critically, the formation of that committee is about having both workers and management represented in it. Just some of this. This is specific to another program. So, look, I think that covers the presentation. My sincerest apologies with some of the glitches and disturbances that have occurred. But I guess, at this point, we're scheduled to finish at 12:30. Is there anyone who wants to make a comment, ask a question? I'll just look at the chat group and see if there's anything that I may have missed. I see some great comments on the chat platform. The floor is yours, guys. Feel free to raise your hand, and I can unmute just for coordination purposes. So just go ahead and unmute and make your comment. Hello, any comments from anyone? Even back on the presentation, maybe it was a bad presentation.
Hello, Mkomo Fungai.
Hi, how are you?
I'm doing well. This is Tendai Sixpence from Zero Power.
Hi, Tendai. Welcome. The floor is yours.
Thank you. I love the presentation. I never thought about, the value that I could play in sort of the transmission of COVID as a small business owner. So this really brought home the reality that there's a lot that we can do, and there's a lot of influence we can make, within our small teams and communities. My only question is, would you toolkit, something that we can sort of, like a checklist that we can just go through and tick to quickly set up some sort of OSH system in our workplaces before we go into the more detailed training, like the score module and things like that? Is there something that we can just quickly get, help us to quickly, and go around and tick so that we quickly start to comply? Because this is I'm realizing it's quite an urgent thing that we need to quickly implement and address in our businesses.
Yes. So look, checklists, those you can create on your own, but a basic one, just from an audit perspective. Now, depending on your circumstances in your workplace, you have enough PPE, as a good start. Do all your employees have? Do you have wash stations? Carrying out regular disinfection, and then taking it further as you conduct your business. Look at where do your persons go to with deliveries, or you yourself, are you having to go to the if you're a production facility, look at what are the high touch points, where are the areas people work together, where there is one or two or more people, and how are they working together? Is it individual work or joint work? So, for example, if I think of you know, two people are now masaga. So, what controls they need in place? The reality is to meal the chibaje and Oktakura Sagamna one, they may not be able to. So you can create those checklists. Look, you can always get in touch with me and we can always assist in terms of a basic one. If you go online, there's also is to look at your circumstances. How are your people coming to work? If everyone is um, if everyone is coming to work on foot, obviously the risk becomes a lot less. Um, but if people are catching the bus, how is it being managed on the bus? So if bus is not yours, you obviously have sitting next to someone else, but put on a mask. Done by people away from can people work from home? Does everyone have to come to the workplace at the same time? Can we do shift work? So those circumstances will vary from enterprise to enterprise. But the basics, I think those are fairly common, and engage workers, train them, educate each other, and also get feedback from them. I hope that assists.
That does, yeah, that does. Um, yeah, thank you so much.
Okay, great. Any other comments, questions? Guys, the floor is yours. Si vanhu vakanyarara vanotanga kuitira kuti pamwe ndatadza kwawo. Okay, there is no other. Thank you so much, guys. I hope you found it useful or applicable. Of course, general, perhaps maybe it may not have gone as far as you may have wanted for to suit your different situations. Um, where you can, feel free to get in touch. I'm on WhatsApp. We've posted an address and other numbers, and we'll provide as much support as we can. Obviously, lockdown, but end it, guys. I think the important thing is, let's all work together. Let's protect each other, whether it be at work or at home. Reality of it, and this is not specific to Zimbabwe alone, but world over, the health systems are struggling. Yes, ours may be challenged from before. Wherever you go, whether it be the UK, in South Africa, in the US, wherever it is, everyone is struggling. I think 6, 7 months ago, sayikunzwa COVID newspaper, kuti zvinzi ningazo kwekuti, it was more high profile persons, but now it's getting closer and closer to home. I think by now we all know someone who knows someone who has died. Some of us now know people that have died directly from the disease, from COVID. And, we obviously have to take consideration of our culture. We are geared to kuchema hama dzedu. Inguva yekuti ngatichemane paWhatsApp, bata maoko, wotumirawo mari yechema neEco Cash. I'm sure soon enough there'll be restrictions on how many people or how much family can come, perhaps even not even family coming to do burials. We've all seen the pictures, Nonzani Doves, na Nyaradzo, they are all busy. Now, it's not for me to comment or to discuss the statistics that are coming, but I think we all know people are dying. So, guys, please take care of yourself, be safe, look after people around you. Garawaita plan, kwero tanga kumaya kuti kurwara or someone opatiza kurwara. And make plan to suit your circumstances. Start buying ventilators and oxygen tanks because they can. Not all of us can do that, but within our control, we can take certain measures. So, guys, thank you. Enjoy the rest of your day and let's stay safe.